Multi-Day Plus Minerals is a multivitamin and iron product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help to maintain good health. This medication provides important nutrients that may be lacking in your diet. It is recommended to take this medication daily with a glass of water, preferably with a meal to help with absorption. It is important to follow the dosage instructions provided by your healthcare professional. Taking Multi-Day Plus Minerals at the same time every day can help you remember to take it. When taking Multi-Day Plus Minerals, it's important to follow the directions provided by your doctor or on the product package. Typically, this medication is taken once daily by mouth. It's best to take it on an empty stomach, at least 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take it with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. After taking the tablets or capsules, make sure not to lie down for at least 10 minutes. If you are taking the delayed release form or extended release capsules, swallow them whole and do not crush or chew them. It's important to take this medication regularly in order to get the most benefit from it. Try to take it at the same time each day to help you remember. If you have any questions about the specific details for your particular brand, consult your doctor or pharmacist. Some common side effects of Multi-Day Plus Minerals may include constipation, diarrhea, or upset stomach, which are usually temporary and may go away as your body adjusts to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist promptly. Iron in the medication may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. While it is rare, a serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Accidental overdose of products containing iron is a common cause of poisoning in children under 6. It's important to keep this product out of reach of children. If an overdose does occur, seek medical help immediately or contact a poison control center. Before taking Multi-Day Plus Minerals, make sure to inform your doctor or pharmacist if you are allergic to any of its ingredients or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. It's important to discuss this with your pharmacist for more details. Also, inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your brand of multivitamin contains folic acid, let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's crucial to consult your doctor before using this medication. This medication passes into breast milk, so it's important to discuss this with your doctor before breastfeeding. It's important to be aware of potential drug interactions with Multi-Day Plus Minerals. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of this product. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to note that this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has taken too much multi-day plus minerals and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Remember to always keep multi-day plus minerals out of reach of children. It's important to follow your doctor's instructions and not share this medication with others. Make sure to keep all your medical and lab appointments. Some brands of multi-day plus minerals may also contain ingredients like docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. Remember, this product is not a replacement for a healthy diet. It's best to get your vitamins and minerals from nutritious foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you are taking multi-day plus minerals on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Remember to take multi-day plus minerals consistently each day for optimal benefits. The recommended daily dosage is, insert dosage here, and it is best to take it with food to enhance absorption. It is important to take multi-day plus minerals at the same time every day to maintain consistent levels in your body. It's important to store multi-day plus minerals at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.